So given all of that, how can and should EPs be fitting into this system? As we saw really early on in the lecture, EPs are totally underutilized, even for things that are right in their wheelhouse, like typical chronic disease like heart disease or diabetes. So as much as I'm sort of saying this is how things should be, it's not currently how they are, and we'll talk a little bit about how you can try to contribute towards improving that. So as we talked about, people typically start by seeing their doctor, who is the gatekeeper for all of these health decisions in Australia. Now, that's not necessarily always the case. People do go directly to see a psychologist. People go directly to see an exercise physiologist. But the reason that most people go via their doctor is because people are driven by incentives, and their insurance company or Medicare usually require a referral for a doctor in order for the patient to get some sort of reimbursement or rebate. And because of that cost effectiveness and because of those incentives, both doctors and clients often will use medication, but we've talked about some of them being limited for some clients. And for the reasons that we talked about with evidence-based treatment, most of these clients will see a psychologist or a clinical psychologist, or in some extreme cases, they'll see a psychiatrist. Just for reference, that a psychiatrist is like a doctor. They're not just doing psychological therapies. They can prescribe medication, but they can also do treatment interventions as well, like the cognitive behavior therapy, interpersonal psychotherapy that we talked about earlier. The main reason that clients don't go and see a psychiatrist is because psychiatrists tend to specialize in really severe mental health conditions like schizophrenia. They tend to have more of a reliance on medication than they do on psychological therapies, and they tend to be much more expensive. I mentioned the standard rate for a psychologist in Australia is about $200 or $250 an hour, whereas for a psychiatrist it's somewhere between $400 and $500. Now, some psychiatrists do bulk bill. It's just that there tends to be a lower amount of supply of psychiatrists. They have to go through different training and specializations, and therefore the supply-demand equation means that it tends to be more cost-effective to see a psychologist for most mental health conditions. Now, what I think is hopefully going to happen more and more over the next 5 years, and with your help, is that GPs will start to identify that most mental health conditions can also be treated with an exercise physiologist. Now, assuming a couple of conditions, that person is likely to be eligible for a chronic disease management plan, which means that they can get about 5 sessions a year with a allied health professional like an EP to do an exercise program. I believe one of the criteria for that is they don't just have one condition, but as long as there's something else going on for the patient, they can get this plan, which means they get 5 sessions partially funded by Medicare. And as with psychologists and with GPs, the exercise physiologist is able to either bulk bill the client or charge a gap on top of that fee that's covered by Medicare. As we mentioned earlier, there are a whole lot of other treatments that are effective for depression and other mental health conditions. I haven't exhaustively listed them all here, but some of them can include online interventions. CBT is a skills-based therapy that can be taught quite effectively through apps and through websites. They work best if they're supervised by someone, which is why these arrows are coming out of the doctor or the psychologist, but they can be good supplementary or adjuvant treatments for mental health conditions. I think EPs and psychologists can work better together here. To be honest, psychologists are in a position where they're the current default when it comes to treating mental health conditions. But by working better with EPs, they can refer to each other, because most psychologists aren't expert in exercise, and EPs, most of them aren't expert in cognitive behavior therapy or psychological interventions. But both EPs and psychologists would like it if clients exercised more. And sometimes the things that get in the way of exercise are psychological, in which case the psychologist can help. And sometimes they're not having the knowledge or skills or support to be able to do it independently. And that's where maybe an EP might be particularly useful. But working together is likely to remove more barriers than either of those professionals could do on their own. And that might include, in many cases, referring to each other. So the reason why that's useful for you is that when you're initially going out there and building your networks, psychologists are going to be quite interested in ways that they can help improve their efficacy. And so I have heard of exercise physiologists using psychologists as one of their sort of main referral sources. Now, to be honest, that does mean that the client would have to go from their psychologist back to their GP to get a referral if they want to be able to bulk bill that or get a Medicare rebate. But that is still a good model for an exercise physiologist to try to find someone who might benefit from their services, particularly, as we said, this is such an underutilized area. Now, both psychologists and EPs and even these apps all have the same goal, which is to try to help the person get more of a sense of accomplishment in their life, a sense of connection, and ultimately reduce their mental health symptoms. One of the useful things that all of these interventions can do is feed that information back to the GP. I think showing demonstrable benefits for clients is one of the things that creates a positive feedback loop here, where if EPs can show that clients are getting fitter and stronger and happier and healthier, and they can present that back to their GPs, their referring GPs can then be more likely to send new clients with mental health conditions back to them. At the moment, it's going to take doctors going out on a little bit of a limb to provide a referral to an exercise physiologist for a mental health condition. And that's why understanding this context and some of the strategies you can do to kind of get past it might be useful, both for trying to reduce the burden of disease from mental health conditions, but also trying to reduce the barriers to entry as a young exercise physiologist. So as you'll read in your readings today, it's a complex and growing area as far as EPs in the Australian mental health area. As much as GPs say that they constantly prescribe exercise, my experience and the experience of some of these economic models is that a very, very small percentage of clients who are referred or who go to see their GP for mental health actually end up going to an exercise physiologist. That is a really big problem because EPs are very effective and cost-effective people for treating what is one of the biggest causes of disability worldwide. So throughout the rest of this course, we're going to work on ways that you guys can better understand mental health conditions, better treat them, and better motivate those with mental health conditions to take actions that you recommend.